Hematology, oncology, embryology. So the first thing we need to understand about hematology, oncology, embryo is where the fetus creates its red blood cells. So fetal erythropoiesis occurs first at the yolk sac, then at the liver, then the spleen, and then lastly at the bone marrow. And then the bone marrow continues growth of red blood cells and all other blood cells later on into adulthood. Hemoglobin development, however, is going to be a little different. So within the fetus, we're going to have alpha 2, gamma 2, and that's going to be known as our fetal hemoglobin, okay? Now, as we are born, we still have fetal hemoglobin circulating around, and that's going to be helpful for patients that have sickle cell disease. Now, as we progress and as we age, our adult hemoglobin starts to become the primary hemoglobin that carries our oxygen, which is known as hemoglobin A1, and it consists of 2 alpha chains and 2 beta chains. So instead of 2 alpha chains and 2 gamma chains, which we see in fetal hemoglobin, we're going to have 2 alpha chains and 2 beta chains in adult hemoglobin. Now, hemoglobin that's fetal hemoglobin has a higher affinity for oxygen because it has less avid binding of 2,3-BPG. And 2,3-BPG is just a chemical that essentially binds to our hemoglobin and allows for oxygen to be released. However, fetal hemoglobin wants to hold onto its oxygen tightly. So it has a decreased affinity, decreased ability to bind 2,3-BPG. That means that it increases its ability to bind to oxygen, okay, compared to our hemoglobin A1. Lastly, hemoglobin A2 is consisting of 2 alpha chains and 2 delta chains, and it's just a separate form of adult hemoglobin that's present usually in small amounts. Next is going to be our blood groups. Patients have either A-type, B-type, AB type, or O-type blood groups. And what we need to understand about these is that whatever type the patient presents with, they will have the opposite type antibody. So, for example, if a patient presents with an A-type blood group, that means that they have anti-B blood group, okay? Same thing with a patient that comes in with type B blood. They're going to have anti-A antibodies. And those antibodies, anti-B and anti-A, exist as an IgM form, okay? And that's important because they are the largest and they cannot cross the placenta. Whereas a smaller group, known as our Rh classification, located on our red blood cells, they are IgG antibodies, hence that they can cross the placenta and attack the child. So a high yield pathology that we need to know that's associated with blood groups is the hemolytic disease of the fetus in newborn, okay? For Rh hemolytic disease, which is a type of hemolytic disease of the fetus in newborn, we're going to have a pregnant patient that is Rh negative, and her fetus is going to be Rh positive. So this fetus has this antigen present on its red blood cell, and the mother does not have that antigen. Hence, when the blood interacts upon that first delivery for an Rh negative pregnant patient with an Rh positive fetus, then that mother is going to form antibodies to our Rh group. And what I said prior is important. That antibody for Rh is an IgG, so it can cross the placenta. So the next time that Rh negative pregnant patient is pregnant with another Rh positive fetus, so her second pregnancy, she has those preformed antibodies that now can cross the placenta and attack the newborn baby's red blood cells, causing hemolytic anemia in the fetus. This can lead to hydrops fetalis, jaundice shortly after birth, and kernicterus. Now, the way that we prevent this and treat this in patients is that we administer anti-D-IgG, which is essentially just the antibody, okay, that is present, the anti-Rh antibody. And the reason that we do this during the 3rd trimester is so that it prevents the mother from creating her own antibodies that can cross the placenta. So the mother's body senses that there's already antibodies present, so it will not create its own antibodies. Hence, once it's not created, it cannot cross the placenta and it cannot attack the baby.